Welcome to the Wisconsin Humane Society Bottle Baby Info Session. This session will be about neonatal kitten care for those considering becoming a foster parent. This presentation is for anyone who wants to care for orphan neonatal kittens with Wisconsin Humane Society. Those who want to know how they can temporarily support orphan neonatal kittens until they can be brought to an animal welfare organization. Those who want to foster older kittens or kittens with a mom, but want to have these skills to provide emergency support if needed. For those who want to help foster neonatal puppies, many of the same protocols apply. Or anyone who likes learning about kittens. Whether you choose to move forward with fostering with WHS, another organization, or just want to learn more about kittens, we welcome you. Foster and bottle baby background. Foster parent guidelines. To become a foster parent, you must have all of the following: homeowners or renters insurance, approval from a landlord if renting, health insurance, and live within an hour drive from a WHS campus. These campuses are located at Sturgeon Bay, Green Bay, Saukville, Milwaukee, and Racine. If you have companion animals of your own at home, all must be spayed or neutered, up to date on their vaccines, and able to be physically separated in your own home from the foster animals. Becoming a foster parent. Want to become a foster parent? Go to the WHS website and select Foster an Animal from the volunteer menu. Here's a shortcut. On the foster info page, the foster orientation video will give you an overview of our program. If the program sounds like a good match for you, follow the link at the end of the video to complete a foster application. Our team will review your application within a few days. Once approved, you will receive 2 emails from WHS providing you with access to the Foster Handbook, our live listing of animals needing foster care, and helpful resources to provide you additional support. If you don't see these emails within a few days, be sure to check your spam or junk folder. If we have any questions about your application, we'll email you to follow up. If you haven't heard from the WHS foster team within 4 business days, feel free to reach out to us at foster@wihumane.org or 414-431-6126. The foster selection process. First, an animal is referred for foster placement based on a variety of factors: age, behavior, medical condition, space, population, etc. WHS lists the animal for foster care on My Impact, which can be viewed by approved foster applicants. Potential foster families can view the listings and sign up for one that is a match that they can pick up within 24 to 48 hours. WHS then contacts the foster parent to confirm placement, determine needed supplies, and schedule the pickup. Next, the foster parent picks up and utilizes the WHS behavioral and medical support system as needed. Finally, the foster parent returns the foster animal as needed for rechecks, vaccines, and adoption. The Foster Facebook Group. This is a private group of over 1,700 active WHS foster parents. It's the perfect place to share photos, brag about your successes, commiserate about challenges, and ask for tips. It's an invaluable way for staff to gain insight into the true ups and downs of our foster parents' experience so we can better accommodate them in the future. It's a safe space to be open and honest, and it's a resource for emotional support. Please remember, it is not a place to seek medical advice. It's not a place for the general public, and it's not a way to connect immediately with staff. To join, find the link within your foster welcome email, once you've been accepted to the program. Answer all 3 membership questions, especially noting if your Facebook name is not your real name, as we compare requests to our database of approved applicants. Staff should approve your join request within 3 business days. Bottle Baby Text Alerts. Because it's vital to get these fragile felines into foster homes immediately, WHS sends out text alerts to those foster parents that are signed up to foster bottle babies. We may also post them in our Facebook group exclusive to WHS foster families. Once you join the WHS foster program, you'll receive instructions on how to also join the Bottle Baby Text Alert group, should you so choose. What are bottle babies? These are kittens who are 1 day to 4 weeks old. Mom cat may or may not be in the picture. They are unable to regulate their own body temperature until at least 3 weeks old. They are also in need of round-the-clock care, feeding and potting every 2 to 3 hours. Lots and lots of sleeping at this age and no real playtime yet. They are very fragile and highly susceptible to illness. Sadly, orphans are at a huge disadvantage, and it's not uncommon for young kittens to pass away. Not because of poor care, but due to lack of maternal antibodies and underdeveloped organ systems. Neonatal kittens need fosters. Disease transmission is much higher in the shelter, and we're not able to staff the building 24/7. If every litter of bottle babies stayed at WHS, care of all the other animals would be impossible. Plus, babies need socialization and nurturing, and you can do it. When neonates have a mom. Make sure to provide an environment that is as quiet and stress-free as possible. Let mom do what she does best. Support and nurture mom. Make sure the babies are getting the proper care. You may need to provide supplemental feeding. Monitor the kittens' weights to ensure proper growth. Handle and socialize the kittens. And watch for signs of illness or failure to thrive. Next, let's discuss kitten health and development. Kitten age progression. At birth, a kitten's eyes and ears are closed, and they typically have a section of umbilical cord still attached. Between the ages of 1 to 2 weeks, the eyes open and the ears begin to open. At 3 weeks, ears and eyes are fully open, their teeth are coming in, and they begin to learn how to use a litter pan. At 4 weeks of age, they're much more confident with their walking and playing, and are beginning the weaning process. At ages 5 to 6 weeks of age, the kittens are continuing the weaning process, switching over from mom's milk or kitten formula over to solid food. At ages 7 and 8 weeks of age, the kittens are now ready to be spayed or neutered and to go on to their adoptive homes. Male or female. It can be difficult to determine sex when kittens are really young and tiny, so recheck them again after they have grown bigger. For females, the genital opening appears like a vertical slit and is located directly below the anus. For males, the penis appears as a small round dot and is a much greater distance from the anus. This space is where the testicles will descend once they've reached that development point. Kitten health. A kitten who is thriving will generally be bright, alert, and responsive, steadily gain weight every day, and have formed regular stool, a fecal score of 2 to 5 every 1 to 2 days. A kitten who is not thriving may feel cold to the touch, be lethargic, lose or fail to gain weight, have a poor appetite or refuse food, have diarrhea, a fecal score of 6 to 7, or constipation, experience upper respiratory infection symptoms like frequent sneezing, eye or nasal discharge, and/or congestion. Strain, but produce no urine or have blood in the urine. Weighing kittens. Neonatal kittens are fragile creatures that can decline quickly. Monitoring their weight closely is crucial in monitoring their overall health. Weigh your kittens every day, at the same time each day, before feeding. A healthy kitten should gain about 10 grams or more per day, or about 1/4 pound, 4 ounces, per week. How to weigh kittens. Kittens can be wiggly, making it difficult to get an accurate weight. Try these tools and tips. Grab a small box or bowl. Place a small blanket or towel in the box or bowl. While the scale is off, place the box or bowl on the scale. Then turn the scale on. Your scale should read 0. Place the kitten in the bowl. If the kitten is still struggling and the weight is bouncing around, try wrapping the kitten in a blanket like a burrito with their face uncovered, and try again. Sometimes you have to wait a few seconds for the kitten to stop moving for a moment to get the most accurate weight possible. Body condition. Utilizing this chart, you can rate a cat or kitten's body condition to determine if they're too thin, of good body condition, or overweight. Fecal score chart. With terms like diarrhea, it doesn't exactly provide the details that a veterinarian really needs to determine the next step in care. However, if you say that the stool is a 6 on this fecal score chart, that gives the veterinarian a clearer picture of what you're seeing. Using this chart, a score of a 1 is a sign of constipation. Scores of 2 through 5 are within normal limits, and scores of a 6 or 7 are signs of diarrhea. URI symptom chart. This chart references the different symptoms you may see with a kitten or cat experiencing an upper respiratory infection. These infections can be caused by a number of different viruses or bacteria, but knowing the specific symptoms they're experiencing can be helpful for veterinarians to determine the next step in care. For example, if you can say the squinting is a 3, the vet can understand how bad that squinting is. So please make sure to include the details of how swelling the conjunctiva is, if there is any, how much squinting there is, and how severe the eye or nose discharge is, and even what color it is. These are all helpful details. Preparing for bottle babies. Supplies WHS may provide: cat carrier, wire crate or playpen, KMR, also known as kitten milk replacer, kitten nursing bottles, miracle nipples and or standard kitten nipples, oral syringes, food or kitchen scale, heating pad or disc, fleece and towels, baby wipes or cotton balls, neonatal kitten care and diet conversion guide, access to support documents via My Impact files, kitten resources, and access to the WHS Foster Facebook group. Temperature. Kittens are unable to regulate their body temperature until about 4 weeks of age, which means they rely on you to provide a heat source. You can use a heating pad on low or a heat disc, but it is important that the kitten also be able to move off the heat source if they become too warm. Kittens in their first week of life need to be kept in an environment that is 85 to 90 degrees and 80 to 90 degrees for kittens 1 to 4 weeks. Because it is difficult to keep the external temperature this high, a heat source is essential. Temperature. Kittens are unable to regulate their body temperature until about 4 weeks of age, which means they rely on you to provide a heat source. You can use a heating pad on low or a heat disc, but it is important that the kitten also be able to move off the heat source if they become too warm. Kittens in their first week of life need to be kept in an environment that is 85 to 90 degrees, and 80 to 90 degrees for kittens 1 to 4 weeks. Because it is difficult to keep the external temperature this high, a heat source is essential. Caring for neonatal kittens. Bottle baby routine. Getting into a routine will help both you and your bottle babies get through the nursing stage. The next slides will go through these steps in more detail. Weigh, stimulate, feed, stimulate once more, as some will urinate or defecate before feeding and some after. Change out any soiled bedding, reheat the heat desk or adjust the heat pad location, record weights, potty results, and formula consumed, and then repeat based on feeding frequency determined by their age, size. See the upcoming chart. Stimulating. Until they're around 3 to 4 weeks old, Mom licks at the kitten's back ends to get them to go to the bathroom. Before and after every feeding, use a warm, moist cotton ball, tissue, or washcloth to gently rub the kitten's genital anal area to stimulate urination and defecation. Record the results of a kitten's potty break in their chart to ensure they're going to the bathroom as needed. Do not rub for more than about a minute, as their skin is very sensitive. Kittens should urinate before or after every meal and defecate about once every 1 to 2 days. When you first pick up a neonate foster kitten, it may take 3 days before they defecate for the first time. If a kitten has diarrhea or constipation, try mixing a little bit more water into their powdered formula for 1 to 2 feedings. Around 3 to 4 weeks of age, introduce a small, low-edged tray with non-clumping litter just covering the bottom. Place a used cotton ball from stimulating into the tray, as this can help them understand what to do and where to do it. Place them in the box after meals. Be persistent, and they'll eventually get the idea. Kitten Feeding and Weight Guide. This chart can help you determine about how much your kitten should be eating and how frequently based on their current age and weight. Please note, these numbers are just guidelines, as weight gain and appetite will vary slightly for each individual kitten. Preparing to feed. Follow the instructions on the KMR, Kitten Milk Replacer, canister to measure out the powdered formula, add hot water, and mix. Tip: a blender bottle is extremely effective in ensuring a clump-free formula. You can make a larger batch of formula to last through several feedings and store the mixed formula in the fridge. Dispose of any leftover mixed formula 24 hours after mixing. Once a canister of powdered KMR is opened and the seal removed, the canister must be stored in the fridge or freezer. You can rewarm the mixed formula by placing the filled bottle or syringe in a mug of hot water or by putting the formula in a microwavable container prior to filling the bottle or syringe. Be sure to shake or stir the formula after heating to ensure there are no hot spots. When using a bottle set, do not cut the tip off the nipple, as this can create too large of a hole. Instead, cut a small X into the tip. You can always make the X bigger if needed, but you can't undo a cut made too big. Hold the bottle upside down to test the size of the nipple. Formula should drip slowly. Formula should be fed at about body temperature, warm but not hot. Test a few drops on your wrist before every feeding. Bottle or syringe feeding. Kittens need to be fed every few hours, around the clock, for the first 2 to 3 weeks of their lives. Follow the previous chart to monitor about how much and how often the kittens should be eating based on their size. The kitten should be facing belly down. Never feed a kitten on their back. Get a drop of formula onto the nipple and work it into the kitten's mouth. Do not squeeze the bottle, as this could force milk down the kitten's trachea and lead to aspiration pneumonia. The goal is for the kitten to suckle on their own. If they don't latch onto the bottle, try syringe feeding with a miracle nipple on a syringe. If you started with a syringe nipple combo, try a bottle. If they still don't latch but are mouthing at the nipple, press the plunger on the oral syringe extremely slowly to give a drop of formula at a time. Bottle and syringe feeding. Nearly all neonates will need practice before they get the hang of feeding. Be patient and give them breaks if they seem to be resisting. Although most kittens will turn away when they've had enough to eat, always monitor how much you've been giving each kitten to ensure you aren't overfeeding. Like human babies, kittens get gas bubbles too, so sometimes they may not want more formula until they've burped. If a baby doesn't eat much in one sitting, move on to the next kittens and come back to this one afterwards. Kittens may occasionally skip a feeding or only eat a small amount at a feeding, to then eat much more at the next feeding. If the kitten doesn't eat well for 2 to 3 feedings, alert WHS or the veterinarian you're working with. Some kittens feel full if they need to go to the bathroom. Try stimulating, then try to feed more formula. Troubleshooting bottle feeding. What to do if the kitten will not latch? Don't panic. If a kitten has recently been separated from their mom, it can take a bit for them to get used to this new way of getting food and new taste to the milk. Check the formula's temperature to make sure it's not too warm or too cold. Also, ensure the kitten isn't too cold. If you made a batch of diluted KMR earlier in the day, dispose of it and make a fresh batch. Wait a half an hour and try again. If the kitten does not latch onto the bottle after waiting, you may need to try to syringe feed. If you started with a syringe, try a bottle. Try putting the nipple on the tip of a syringe and placing a few drops of milk on the kitten's tongue. This may encourage them to latch, but if it doesn't, continue to feed them drop by drop. Troubleshooting bottle feeding. What to do if the kitten will not latch? Brushing kittens with a toothbrush imitates the feeling of their mom grooming them, which you will do often when it's time for them to eat. Doing this may also help them get in the mood for a meal. You can swaddle squirming kittens in a burrito, like the picture, and feed them more upright. If tiny kitten nails are scratching your hand as they nurse, you can prop the bottle or syringe on a plush toy so they need that instead of your skin. If you begun the weaning process by adding a little canned food to the formula, reduce the amount of canned food added or go back to only KMR before slowly increasing the amount of canned food mixed in again. If the kitten is uninterested in eating for more than 2 feedings, contact WHS or the veterinarian that you are working with. Continue to syringe feed to ensure they stay hydrated and their blood sugar does not drop. Bath time. When it comes to cleaning up, less is more. Kitten formula dries on like glue, so you may not be able to get it all out, and that's okay. Weaning kittens will be messier yet as they learn to eat food from a dish. It's okay if a kitten is a little messy, rather than risking them getting too cold or missing fur due to rough scrubbing. Spot clean. Using a baby or pet wipe, damp cotton ball, or damp washcloth, spot clean as needed throughout the day. This is the recommended way to clean a kitten. Tush bath. Kitten tushes can get extra messy without a mom to clean them up. You can place the kitten's hind end under warm water while using a kitten-safe shampoo. Keep the session short and get the kitten towel dry and back onto a heating pad or disc quickly to avoid chilling them. Full bath. Only give kittens full baths if absolutely necessary. This can be a scary, stressful experience for kittens and risk them getting cold. Make sure to only use shampoo labeled to be safe for kittens. Move quickly and carefully, and get the kitten's towel dry and back on a heat desk or pad quickly. Bathing tip. Damp kittens get chilled quickly, so have all your tools ready before you start the water running. Keep bathing sessions short. Return them to their warm, clean nest as soon as possible. Caring for weaned kittens. Weaning. Weaning is the process where kittens transition from formula or mom's milk to solid food, dry and/or canned. Kittens will typically begin to wean onto wet food at around 3 to 4 weeks of age. At this same age, they will be learning how to use a litter pan. It is vital that you go slow when transitioning your kitten's diet to ensure their gastrointestinal system has time to adapt to the change. When beginning to wean an orphan kitten, slowly begin to mix a small amount of wet food into their bottle and increase it slightly every day. Kittens should be almost completely weaned by 5 to 6 weeks of age and completely weaned by 7 weeks. You can utilize a bathtub or shower when introducing kittens to eating from a dish for easier cleanup afterwards. Most importantly, be patient. Every kitten is different, and it may take some much longer to wean and use the litter box than others. Don't hesitate to contact the foster team for support. After the kittens are weaned, fostering becomes a whole lot easier. Now it's your job to refill dry food and water twice daily, scoop the litter box daily, continue to monitor weight a few times a week, follow the parental oral dewormer dosing chart, watch for and report signs of illness, ensure kittens are keeping themselves clean, provide valuable socialization and nurturing, offer opportunities for enrichment, bring kittens to WHS for preventative care, reference kitten care and socialization handouts, contact the foster team for needed support. Kittens must weigh 1.8 pounds or 1 pound 10 ounces and be healthy to be spayed or neutered and move into the WHS adoption program. Contact the foster team to schedule these next steps. Don't give up. Realities of caring for neonates. It will be exhausting. Try involving another adult or older responsible child in the home for some feeding shifts so you can catch up on rest. If your kittens are eating well and in good health, it's okay to wait 4 hours between one shift overnight. Better to have them wait an extra hour than have you burn out. If you know of a friend or family member who wants to foster bottle babies but can't commit for the entirety of the duration, they can join the foster program and you can sign up as buddy fosters to share the kittens in shifts, no shorter than 1 week in a location at a time. And make sure to stay in contact with the foster team so we know where the kittens are located. Some kittens will not survive, no matter how perfectly they're cared for. Research suggests that 15 to 40% of kittens will pass away before 12 weeks of age. Young, orphan kittens are at a huge disadvantage in life, as their systems aren't equipped to deal with illness, congenital defects, or other complications. Though this can be very difficult to witness, the reality is that 100% of these kittens would not survive if we didn't try. Lean on your fellow foster parents. The private Facebook group is a safe place to grieve and gain support. It will also be adorable. Take as many pictures and videos as you'd like and share in the foster Facebook group. It will be empowering. You made it through weeks of 3 a.m. feedings, a mountain of messy cotton balls, and load after load of laundry. You are quite literally a lifesaver. Without you, these babies never would have survived. It will be one of the most rewarding experiences you could have. You will undoubtedly bond with these little ones and will know them better than anyone. You will help them develop the habits they need to be successful in their future homes. You will likely fall in love, and it might feel impossible to let them go when it's time for adoption. Thank you. We deeply appreciate your assistance in caring for our most fragile felines. Ready to foster for WHS? Use this link here, or go to our website, wihumane.org, and click on the Foster tab. Do you have questions about the foster program? Contact us at 414-431-6126 or foster@wihumane.org.